Topic under discussion today is about the meningitis. Now, this topic will be discussed with respect to 5 points in a very simple and easy way. Now, before moving towards the discussion, I would love to tell you people about the points first of all, because these are the points which will help us to understand the lecture and will help us to go through in a very easy way. So, well, first of all, I will tell you people about the definition, then I will go through the cause of the meningitis. Then I will go through the pathophysiology, that how this is actually caused. So we will talk about the mechanism, that how meningitis is actually caused. Then we will talk about the diagnosis, how to diagnose. After that, we will talk about the treatment, that what is the possible treatment or the treatment actually available for certain types of the meningitis. Well, so let's get started from the very first point, that is definition, how to define meningitis. Very simple. Looking to the term, from the term, now we will define meningitis in a very simple way. How? Like very simple. Now just go through this term, meningitis. Now split this term into two. Meningitis. So we got two terms. One is meninge, another is itis. So this is the very first term, that is meninge. Another term is itis. So these are actually two words combined together and making one term, that is meningitis. So meningitis is a single term composed of two sub-terms, or you can say sub-words. Meningitis. So meninge are actually meninge. This term stands for meninges, and itis stands for inflammation. So in short, what is meningitis now? Going through this split mechanism, first of all, we split the word. Now, from that splitting mechanism, we will just get our definition. How? Like simple. When we are going to define meningitis, we will say that it is actually the inflammation of meninges. Simple. Now, what is meningitis? A question is asked in exams. What is meningitis? You will define it in a simple way, that this is actually the inflammation of meninges. Now, from where I got this definition, very simple. I just looked the term. I just focused the term that meningitis is actually composed of two terms. Meningitis, meninge stands for meninges, itis stands for inflammation. So in short, inflammation of the meninges is called meningitis. Got? Very simple. I hope it's clear now. Now, a question arises is that what is meninges term? This term actually is for the layers that are protecting our brain. Here we got the brain. This brain is having a protection from by mean of the three layers and one skull. Here goes the skull. Then we get three more layers like DAP. This is actually a kind of mnemonic for you guys to learn the names of the layers. DAP stands for DAP. Three layers named is number one, dura mater. This is the dura mater. Then we have arachnoid and pia mater. Dura mater, arachnoid mater, and pia mater. Now these three are the layers which are named as meninges. So in short, inflammation of these layers, known as meninges, is called as meningitis. Okay, I hope the definition portion is clear. And one more interesting point that you guys must memorize is that between the second and the third layer, while going from top to bottom, okay, this way, descending order, dura mater, arachnoid mater, and pia mater. Just cross the first one, D, dura mater. Between the arachnoid and pia mater, there is a space known as subarachnoid space, in which there is CSF. Got? Now, this is the portion. The CSF is actually the main portion where there will be the inflammation observed. When we are diagnosing, so we also go through CSF. Through CSF, we diagnose whether there is meningitis or not. One of the best diagnoses done is actually going through the CSF, cerebrospinal fluid. So we got the definition and we got the main site of the meningitis. Okay, definition plus main site. We defined it. Now let's move towards the cause. What are the causes? Simple. Bacteria, mostly is actually bacteria on the topmost. Then we have viral infections, fungi, adverse drug reactions, means when you're taking drugs, from some medication, when you're using, through that actually we can also have meningitis. Autoimmune disease is also the responsible cause, and some of the factors may also cause meningitis. Well, then we go towards the third one, that is the pathophysiology. Now, how the meningitis is actually caused? Very simple. We got here the pathogens. So when the pathogen enters, whether it is directly or indirectly, we call this direct mechanism because it is actually getting into the CSF directly by means of an injury. Suppose through an accident, when a person gets an accident, so from that, when the skull is broken, through the skull that will pass, the pathogen will go through the skull and then the dura mater, and then it will reach the CSF, where it will then cause the inflammation further. And sometimes, and most of the cases, this pathogen is actually going through the blood. Now, from where it comes into the blood, simple. From the atmosphere, from the environment, when we are going through anywhere, so through the oral route, through the any route like an inhalational pathway or any other factor that is actually responsible to allow the pathogen to go into the blood. So when the pathogen moves into the blood by any means, and when it moves into the CSF through directly, through direct mechanism, so whether it is direct or through any means by means of blood, so if the pathogen reaches or is actually having an approach to the CSF, and when the pathogen reaches or gets its approach to the CSF, then where there is the blood available, so we have actually blood-brain barrier and blood cerebrospinal fluid barrier. Okay, so this blood-brain barrier is actually a kind of tough type of barrier, whereas blood cerebrospinal fluid barrier is a kind of weak because it may allow. It is also tough, but with respect to BBB, it is actually a kind weak. So this may also allow for certain pathogens to go through it. So when these barriers are actually allowing these pathogens to enter, so what will happen then from the blood and from the blood cerebrospinal fluid, there will be actually the from these two barriers, okay, from these two barriers, then there will be the movement of the WBCs. So what will happen next? Then WBCs will start moving and they will start surrounding this pathogen will be surrounded. And in the meanwhile, these WBCs, which are actually available here, they will start releasing cytokines, some chemical mediators that will call furthermore WBCs and etc. to fasten the process, means to speed up the process of the fighting against the pathogens. So what happens if the WBCs are actually in a very quick fashion here? So by means of this release and accumulation of certain WBCs and etc., what will happen here? And inflammation will happen. So we can say that this is the stage when the infection will start. Infection starts, that will lead towards the inflammation, and we call that as meningitis. When it is actually here in the layers, okay? Remember, when it is about this portion, this is meningitis. When the infection and inflammation is other than this place, other than the meninges, then we get these terms like meningeal encephalitis, meningeal cerebral meningitis, and cerebral abscess. We'll tell you people about this in the diagnosis region. Okay, first of all, coming to the point, so what will happen is the pathogen approaches the CSF, WBCs will come and they will release cytokines. That cytokines, then they will actually lead towards the inflammation, and that is actually called as meningitis. Because of the pathogen, this is happening. Okay, if there is a pathogen, there will be the movement of the WBCs, and there will be the movement of all these things happening. So this is actually the scenario that I'm telling you guys. Now, just revising this pathophys once again, in short, in brief way. Pathogen, if it is getting entry into the CSF directly or by means of blood, so what will happen? Those pathogens will come and WBCs will move towards. So as WBCs come, they interact with the pathogen. In the meanwhile, they will release cytokines. They will call further more WBCs, and some other chemical mediators will come. So because of these mediators, some other chemicals might also come to the CSF, and that will actually lead towards the meningitis. Okay, this is the shortcut pathophys. Well, I hope you got this pathophys. If still you have confusion, drop in the comment box your questions. We'll come for the answers very soon, inshallah. Yeah. So this is done. Now let's move toward the diagnosis. Diagnosis, here we got, I told you people in the beginning that this portion, lumbar region, from L3 and L4, if we take the CSF, from the CSF, we can easily and somehow perfectly diagnose the meningitis, and what sort of meningitis is actually there. So in short, what we do when we are taking the CSF, we actually go through the WBCs. If WBCs count rises, specifically if you take CSF, according to CSF, it is believed that we are taking 1 microliter of the CSF. So in this amount of a CSF, when we are observing the WBCs in this amount, we took the CSF 1 microliter, and in that, if we observe the number of WBCs, if WBCs are less than 5, it is okay. Less than 5, WBCs, if there is less than 5, then it's okay, there is no meningitis. But if the number has increased, that is more than 5, in some books if it is 5 or more than 5, then the case is obvious of the meningitis, means the particular patient has meningitis. What if we take the CSF? In the CSF, if we observe in 1 microliter of the CSF, if we observe more than the 5 WBCs, then that is actually what that patient is having meningitis. I hope we got. So now there are several other factors which are also helping us to diagnose meningitis, like through symptoms, like headache is the severe type of fever, and photophobia and phonophobia means through the photo means light, so cannot go stand against the bright light, and if there is a kind of noise, so phonophobia is also observed. So these are also helping us to diagnose the particular meningitis. So I told you beginning here a moment earlier that we have several types of meningitis, and there are several other factors also through which we can observe or we can diagnose the patient. Like in case of meningeal encephalitis, there are some other factors that are actually helping us to diagnose the patient. So in short, there is just not only 1, 2, 3 factors or 1, 2, 3 symptoms through which we can observe the diagnosis in easy way or at once. So we are supposed to go through multiple factors, multiple steps to observe and to reach the core of the particular infection, just like in case of inflammation of the meninges, like meningitis. So for that, what we do, I told you people here a moment earlier that meningitis is actually a specific term used for the meningeal infection, and when this infection is actually meningeal inflammation, okay? So when this inflammation is not in the meninges, it is other than the meninges, but in a local portion, like mainly in the brain, we call it as meningeal encephalitis. Or we can also call if the infection or the inflammation is actually here in the meninges, and sometimes it actually moves to the brain itself, okay, brain. So these are the meninges, these are the layers. So if the inflammation is other than the layers, then we give some other names, in short. So if it is in the brain, we call it as encephalitis, and when it is anywhere but other than the layers, and having such kind of mechanism, like this is a central nervous system. So if it is actually here at this portion, particular portion, and this kind of inflammation is actually observed because of an infection, so we call that as actually cerebral meningitis. And if the same type of inflammation is there, but this inflammation is actually a kind capsulated, there is a capsule available over this, so then we call this as cerebral abscess. So I hope you got the understandings of these terms. So in short, what we got in the diagnosis step, in this step, now I'm talking about this step in a nutshell. So what is in the diagnosis? In the diagnosis, we diagnose the patient whether the patient is having meningitis or not. So what we do in most of the cases, we go through the lumbar puncture. We take the CSF from the L3 and L4 region. Then in that CSF, we just take a particular amount, that is 1 microliter of this CSF. We then count the number of WBCs. Excuse me. So if the number of WBCs are less than 5, it's okay. If more than 5 or 5, according to some texts, then that patient is actually meningitis, having the disease particular. That is actually meningitis. So this was actually in the diagnosis step. So there are some other factors through which we can also diagnose, like headache, fever, photophobia, phonophobia. So these are actually the steps through which we can go through. After that, I told you guys a little bit about these terms. You can also have these terms when you are actually going through some advanced studies of the meningitis. Anyways, so this is in short. Meningitis is specifically in short with this particular region. So I was talking about meningitis only, but I got it helpful to tell you guys these also. If you don't learn these, or if it is confusing for you, forget about this. Just go through meningitis. And what is meningitis? Simple. Inflammation of the meninges is meningitis, and this is the meninges where we have 3 layers protecting our brain. Layers protecting our brain. And then here we have skull. So like this, we completed our diagnosis step. Now let's come towards the treatment. Regarding treatment point of view, we can go through steroids, antibiotics, antiviral, antifungal, and etc. That is depending upon the patient, condition, age, factor. So according to that, we then manage the treatment strategy, and along with that, we treat your patients. So now let's revise the entire discussion within a while and in short duration of time. So what is now meningitis in short? Now, all the points will be discussed in a very simple and easy way. It is actually a kind of review of the entire lecture, okay? So let's review the entire lecture. Meningitis, how to define? Simple. Split the term. into two. Meningitis. Itis is inflammation, meninges, meninges. So inflammation of meninges is called as meningitis. Okay. Now what is meninges? Meninges are actually the layers that are protecting our brain. One, two, three layers which are protecting our brain. So this is the brain layers, they are protecting our brain. So these layers are actually called as meninges. So in short, if in these layers, if in these layers we find this inflammation, that is actually called as what? Meningitis. So inflammation of the meninges is in meningitis. Now, what are the causes? Bacteria can be the cause, and the very prominent cause it is. Virus, fungi, adverse drug reactions. Because of some drugs, you can also get the meningitis. Then we have some autoimmune diseases and some other factors. Then we have the pathophys, how this meningitis is actually caused. Very simple. How this inflammation is actually observed. Simple. The pathogen, whether it is by means of direct means it is getting directly from the skull into the, when the skull is damaged. So from the skull into the dura mater, arachnoid mater, then it comes to the cerebrospinal fluid. Now here is this pathogen enters to the cerebrospinal fluid. The story starts from here. Then by means of the blood, if it is getting through blood to the cerebrospinal fluid, so guess what? The pathogen is actually here now. As the pathogen reaches the cerebrospinal fluid, then here the story is actually happening. That is, so then pathogen will be actually surrounded by the WBCs. So the WBCs will start moving towards the pathogen, because it is the work of the WBCs to approach the pathogen and to fight against it and to destroy it. So what will happen is, so as WBCs come, they will first of all identify the pathogen. After the identification, they will release some cytokines, some chemical mediators, which will further increase the process of fighting. So at the end, what will happen? After the inflammation will be observed. So then that is actually called as what? Meningitis. I hope you got this metaphors. Then we talked about the diagnosis, and the diagnosis we talked about the factors and some terms. And I told you people that in the diagnosis we must go through the cerebrospinal fluid. We must take the cerebrospinal fluid, and we must count the number of WBCs. If they are less than 5, there is no meningitis. If they are 5 or more than 5, according to texts, okay. Some books state that it is more than 5. Some books state that whether it is 5 or more than 5. So the condition is that if WBCs are increasing from the 5, then there will be actually the case. The case is actually of the meningitis, okay. And then I talked about that there are some other factors also through which we can diagnose, like headache, fever, photophobia, phonophobia. So this was actually the diagnosis. And then after that, in the diagnosis, I told you people about some terms relevant to the topic. So these were actually a kind of confusing terms for the students. I cleared these terms. So if still these are confusing for you, drop the questions. Otherwise, regarding with respect to meningitis, forget about these terms. With respect to meningitis, you must remember just only meningitis term. So if you're learning these also, it is actually a kind of, you can say, very beautiful speaking. So if you're learning more about a particular point. Well, so this was actually in short, little more about the topic. So in short, diagnosis is actually this L3, L4 cerebrospinal fluid and these symptoms. Through the symptoms and through this lumbar puncture cerebrospinal fluid. So if we take cerebrospinal fluid and if you go through these symptoms, we can easily diagnose. Well, now let's come towards the fifth point, the review of the fifth point. Here we talked about the treatment. So for the treatment, you can go through the steroids, antibiotics, antiviral, antifungal. You can use any of the drugs, and with respect to the patient, you will use the drugs and you will go through a particular strategy to treat the meningitis. So I hope you got the entire discussion. If still you have confusion, drop in the comment box. Thanks for watching.